Thanks for watching TMA's Legislative News Hotline for Friday, February 24th. I'm Brent Anir. We have several stories this week on a busy week. This week we have bills filed to show which school students have fewer vaccine exemptions and which have more. And TMA testifies in favor of graduate medical education and public health funding. Coming up, these stories and more. But up first, should parents be able to tell which schools have more vaccinated students and which have fewer? This week, Dr. Representative J.D. Sheffield of Gatesville filed House Bill 2249, and Senator Kel Seliger of Amarillo filed Senate Bill 1010 to make that information accessible. The state already records when students like these are vaccinated before enrolling in school, and conversely, when students' parents choose to have their children opt out of vaccinations. Currently, that information is only available on a district-wide basis. TMA and the Texas Public Health Coalition both believe parents should be able to see aggregated vaccination rates at the school level, so the parent of a child who cannot be vaccinated and therefore is more susceptible could make an informed choice about which school in which to enroll that student. The likelihood of a school with a higher percentage of unvaccinated children is growing. The number of Texas children with exemptions has risen from 2,314 in 2003 to 44,716 in 2016. We will keep you posted on the bill's progress. Wednesday, a TMA medical student leader asked lawmakers to adequately fund graduate medical education. Kayla Riggs, a fourth-year University of Texas Health Science Center at Houston medical student and member of TMA's Board of Trustees, explained to the House Appropriations Subcommittee on Article 3 why maintaining GME funding is so important. She said the investment is needed to keep pace. Texas will graduate close to 350 more medical students by the year 2022 than currently, and we will need to add residency slots to keep up. She said choosing residency is one of a young physician's most difficult decisions, and we need to give them options to help them care for Texas patients.
To the extent possible, we strongly support your help in funding more GME positions and those that have been created through the state grant since 2014. Unless your support is continued, the new positions that we have will likely be lost to the state. Unfortunately, then our graduates would be lost as well.
Committee Chair Representative Trent Ashby gave the medical student a thoughtful reply.
Kayla, thank you for your powerful testimony. You're exactly what we're trying to do. And so thank you for being here. It means a lot, I know, to all of us on the subcommittee.
Here are TMA's top funding concerns. Continue state support for GME positions previously developed using GME expansion grant funds. Keep pace with increasing numbers of medical school graduates at the state's target ratio of 1.1 entry-level GME positions per each Texas medical school graduate, and address proposed cuts to special item funding for medical schools and health-related institutions. Thursday, TMA expressed grave concern over potential funding cuts to the state's public health infrastructure. TMA urged the House Appropriations Subcommittee on Article 2 to adequately fund the Department of State Health Services, particularly the department's key exceptional item requests. They include ensuring basic public health capacity, strengthening the state public health laboratory, and preventing and controlling the spread of infectious diseases. We caught up with Austin's Dr. Phil Wong, chair of TMA's Committee on Infectious Diseases, as he waited to testify. TMA's joint testimony with the Texas Public Health Coalition and 5 specialty societies says now is the time to protect public health capacity and infrastructure to make sure children and pregnant women are vaccinated and protected from preventable diseases, and also clinical staffing must be adequate and should communicate with local physicians to respond to infectious disease outbreaks and other public health threats. And the testimony also urges holding the line against chronic disease threats and maintaining prevention efforts like tobacco control, priorities of Dr. Wong's.
In particular, I'm addressing some of the cuts in funding to the chronic disease program and also the tobacco prevention program. Tobacco prevention remains the #1 preventable cause of death and disability in our state, and also chronic diseases are the leading killers and also some of the most costly diseases and conditions that we deal with. And many of these costs are preventable with appropriate investment in these preventive activities.
All of these public health and prevention goals are at risk given the tight budget this session. We will keep you posted. Caring for Texas children was the focus of a priority bill passed by the Senate Health and Human Services Committee this week. In a brief meeting Wednesday, the committee unanimously passed the committee substitute to Senate Bill 11 by TMA physician member Senator Charles Schwertner. The bill overhauls the Texas Department of Family and Protective Services. That's the agency that takes care of abused and neglected children. One change ensures children entering the state system would receive medical exams within 3 days. The bill next goes to the full Senate for consideration. Tuesday, TMA urged lawmakers to add more public health expertise to the state's Environmental Board. TMA asked the House Appropriations Subcommittee on Articles 6, 7, and 8 to appoint a physician to the Texas Commission on Environmental Quality. TMA said Texas's physical and fiscal health would be better served if the agency had public health input into studying environmental quality issues, since environmental issues like poor air quality can threaten people's health. Mark your calendar and make plans now. You have just over a week until the second TMA's First Tuesdays at the Capitol event this session. That's Tuesday, March 7th. Make plans to join your colleagues in Austin and visit legislators to advocate for good patient care. That's it for this week. I'm TMA's Brent Anir. Thank you for watching, and please join us again next week for TMA's Legislative News Hotline.